Hi, my name is Art Garcia, and I'm Made for More Bariatric Surgery.
Welcome back to the Made for More podcast. Today's guest is Dr. Art Garcia. He's the Director of Metabolic and Bariatric Surgery at Adventist Health and Rideout. Dr. Garcia joins us to discuss the success of the bariatric program here at Rideout and to talk about the impact that it's made on the health of our community. Well, Dr. Garcia, thanks so much for being here. I really appreciate getting a few minutes to talk to you. I wanted to start off by saying, how are you? How are things? I know it's been a busy start to the new year. How are things going?
Things are going great. Always busy in surgery and bariatric surgery. But I'm happy to be here to spend some time with you and talk about bariatric surgery.
Yeah, definitely. There's a lot of things that I do want to talk to you about, surrounding bariatric surgery at Adventist Health and Rideout. But I think a good place to kind of start is talk a little bit about you, get to know you and kind of your background. I want to ask, where you're from, where you grew up, and then really what was the inspiration to kind of get into the medical field?
Got it. Yeah, I was born in Mexico. My family migrated to the U.S. when I was 4. And so I grew up in Central Valley, California, like Fresno area.
Yeah.
So just south of Fresno, a small town called Fowler, and they were farm laborers. So that's kind of background I grew up with.
Yeah.
Hardworking family, and they prioritized hard work and school. And so kind of went through the system and then went to undergrad in San Diego and then medical school at UCSF. And then residency in Bay Area. And really, I think what drew me to medicine, or the path that I chose, is we didn't have any physicians in the family or medical personnel in the family, but I think just at some point I decided to volunteer at free clinics and really got into the medical field in that aspect.
Yeah.
And that kind of led me into the medical path and then eventually what I'm doing today.
Yeah, definitely. Was there something about it that kind of drew you to it when you first started, like kind of dipping your toes in that area? Was there something that said, "Oh man, this could really be for me"?
I think there was just such a need for, medical care. I mean, luckily myself and my brothers, we all grew up healthy, so we didn't have that much medical need in our family. But then when I saw people who were similar to me, who really had that need for medical care, and then when you volunteer doing that and you provide that care, it brings a certain satisfaction to be able to help people who are similar to yourself, right? Kind of like similar to people in your community. And so that's really what drew me in initially into the medical field.
Yeah, definitely. That's awesome to hear. I wanted to take us through maybe the kind of the timeline that got you to here. You said you went to undergrad in San Diego and then went on to residency, or medical school and then residency, of course. What ended up bringing you here to Rideout?
Yeah. I mean, I've been in California since we moved here. From Mexico. So San Diego to Bay Area, I was slowly starting to move north, partly because my family was Central Valley. When I got married, my wife's family was from Sacramento.
Yeah.
And so I think we always had the idea that we'd be close to one of our families, and one of myself or my wife's family. And so obviously the field that I chose, surgery, had nothing to do with where I was going to live. But once I had that degree and had the training, I was able to choose where I wanted to live and what kind of community I wanted to live in. And Marysville, Yuba City was really kind of the ideal situation because it reminded me so much of home, and it was close to my wife's family. And so that's kind of how I ended up in this location. In terms of surgery, I went into medical school thinking I would do primary care.
Sure.
But once I got into the operating room, it was just a whole different deal.
Yeah.
And it's that idea of working with your hands and seeing immediate results that kind of reminded me of the work that I did growing up, where I was working with my hands and being out there. So that really caught me into the surgery field. And then obviously the location, just family.
Dr. Garcia, you mentioned right there about surgery being kind of an entirely new ballgame. As soon as you got in the operating room, you kind of were drawn to it. What is it about maybe bariatric surgery specifically that you really have a passion for, and what makes it something that you really care about? Because you very clearly do.
Yeah, I think there's kind of two parts to that question. the surgery part, what really excites me about surgery is you're in a room and everyone in that room is completely dedicated to having a specific outcome, to taking care of a patient, and completing the operation that's needed. And so that teamwork in that room, and the intensity in that room, but also the idea of, there's a common goal. I think that's really drew me to the operating room. And the operating room is really, it feels like my safe space. It's really the most joyful part of what I do. Bariatric surgery had an additional component. It was not just about, hey, this person has appendicitis, we got to take out the appendix, or this person has a hernia, we got to fix a hernia. There's a lifestyle change associated with that surgery. And you would see that. You would operate on someone, and then you see them in follow-up, and they start losing weight. So there was a physical change that you would start seeing in people. In addition, people would start saying, well, I don't have to take my diabetes medication anymore. I've cut back on my blood pressure medication. I can sleep without a CPAP machine. So all these things about the patient's health was changing in front of your eyes over the course of several weeks. Stuff that they may have been working on or haven't had treated for years. And so that stuff, that immediate rush in the OR plus that sustained kind of realization, hey, I am helping people in the long term, I think that's what really drew me to bariatric surgery.
Yeah, that's so fascinating. I mean, being able to change people's lives with the work you do. And of course, everything we do at the hospital changes people's lives in some way, but being able to really help them get into the lifestyle that maybe they always thought they were meant for, or change the way they look at being healthy. I mean, that's such a powerful thing that you and your team are able to do.
Yeah, medicine is about changing people's life, but it's that tangible aspect of saying, I can actually tell there's a difference.
Yeah.
Versus, my cholesterol is lower, but I can't feel a difference. But to actually see a difference, to feel a difference, that's what was really unique.
Yeah, absolutely. That is really, really fascinating. Yeah. I want to ask you about when you came to Rideout and kind of, surveying the hospital, looking at the program, and really talking about the vision that you had for bariatrics at Adventist Health and Rideout. What goals did you have? Where did you see bariatrics kind of going? What was kind of the mindset coming into Rideout?
So after residency, I went to do a fellowship at UC Davis for a year to specifically train on bariatric surgery. And when I came out of that fellowship, my goal was to work somewhere where I could start a bariatric program, a bariatric surgery program. And obviously I had some geographical kind of checklist as well that I wanted to fulfill. So rural kind of area, Sacramento area, and really Rideout fit all those. At the time, I was lucky that they were looking for someone, for a general surgeon who would also start a bariatric program. And so it kind of all just fit together at the right time to come to this area. But since I've been here, it's been phenomenal. Like I said, really all the stuff that drew me about a rural community were here. But in terms of my goals, I mean, the number one goal was to start a bariatric, a nationally recognized, comprehensive bariatric program. And that was almost 10 years ago. Yeah. And so I feel like it's still something that we're working on, but definitely we've made a lot of huge strides. Yeah,
definitely. And of course there's, challenges and growing pains with starting a program from, in a lot of ways, the ground up, right? Can you talk about some of the, let's say, things that you had to navigate, roadblocks that you faced as you went about building this into a really respected and quality program?
Yeah. I think one of the biggest roadblocks to bariatric surgery in general is just lack of information or education of not only patients, but the referring providers that, surgery is not something of last resort. I mean, patients that seek bariatric surgery have been trying to lose weight for a long time. And so really that education part about what is bariatric surgery, what is it that we do, that's one of the biggest barriers we've had to just educate patients and providers. On top of that, you layer things like, yes, this is a rural community. It's not a huge hospital. How do you start to provide all the comprehensive services that you need to get this kind of service line off the ground? How do you get that in this area? Like, we need dietitians, we need behavioral health people, we need equipment, and sure, you can make those numbers work sometimes for some things, but we're just sometimes not big enough to make the numbers work for everything. So administrative, financial kind of hardships we've had to get through, but education, I think, has been the biggest thing.
Yeah. Yeah. And I think, that's such a great point you made. It's so much more than just, the surgeries themselves, or that there's such an infrastructure that has to be built around it to support everything you guys are doing and to support your patients in the community. When someone's being referred for potential bariatric surgery or is coming into the bariatric program, what kind of questions do they usually have? I guess, what are the most common questions that you face when you're talking to new patients about the program, about bariatric surgery, about all of that?
Yeah, I think patients have a lot of questions. Some of the bigger questions patients have is, obviously what the surgery entails. And there's a lot of misconceptions about bariatric surgery. This is not a cosmetic surgery. We're not just removing fat. And we're actually changing the gastrointestinal tract. We're making changes to help patients make better food choices, but also help patients in terms of the absorption of the calories that they do take. But there's also changes in the metabolism of their glucose and sugars, the hormones they produce that help make them feel full, even to decrease inflammation. So the surgery is really a metabolic surgery. It's not a fat removing surgery. So that's something I think patients have, first meetings, sometimes they have questions about, what is that the operation entail? And that's what it entails. And then there's a lot of questions or concerns about patients about, long-term, they'll have questions about excess skin, long-term follow-up, vitamin deficiencies, nutritional problems. And so really it does take a lot of education, and which is why usually the time it takes from I first see a patient to surgery is about 7 to 8 months, because there's a lot of things, a lot of components that have to happen before a patient has an operation, because we're doing the education, we're doing the medical workup, all these things that come together to an actual surgery.
Right. You mentioned, that this program has been pretty much 10 years in the making. I wanted to ask you about kind of when, or if there was maybe a moment, an experience, a period of time where you start to really see that this program is making a difference, is becoming what you want it to be. Is there, I guess, I don't want to say a turning point, because like you said, you still have ambitions, you have things you guys want to accomplish with this program, of course, but is there a moment that sticks out to you that says, okay, we're here, we have a bariatric program, it's making a difference in the community, I'm happy about where we're headed with the program?
I think there's a couple of moments like that. One of the most obvious moments is when we became accredited center. So the American College of Surgeons accredits all these bariatric surgery centers as either low acuity or comprehensive center. They got a couple different accreditations. So when we started doing surgeries, we were building up that accreditation. And when we actually got accredited as a low acuity center, that was a big moment for us. Yeah. That was kind of telling us, hey, yes, we have a quality program. We're meeting all the national benchmarks for quality and safety. And this is a legit operation. And so that was really exciting. Since then, we've improved our accreditation to now we're a comprehensive center. So this kind of validates that we are doing a good job. And we do have really good results. And we know that because we are now graded against all the hospitals across the country that do this. Another time where I can tell, hey, we're doing a good job is we start seeing family members of patients we've already operated on come and seek our care. Yeah. And so when you start treating 2 or 3 people of the same family, it kind of shows you, hey, we're doing a good job. It's spreading that word of mouth. Yeah. And that feels really good when I see someone, I take care of their father, and then I'll take care of their brother. And it's just, having that confidence in me to say, yeah, you took care of me, you can take care of my family too. That feels really good. Yeah. And it's obviously a point where I can say, yeah, we're really making a difference here.
Yeah, I got some goosebumps there, because that's got to be one of the most validating things, right? Not only did you take great care of me, I would trust you to take great care of my family members. That's our president, Chris, always talks about that. We want you to be able to talk to your family members and say, hey, Rideout's where you want to be for your care. And to see that and to experience that in real life, that's got to be, like you said, very gratifying, validating,
Yeah.
all the hard work you guys have put in this program. It's probably for moments like that.
Yeah. And to be truthful, I wanted to build a program where I would be comfortable offering this to my own family, to my own friends, something that I would be saying, yeah, come do it here. I am proud of what we do. I think we offer great work, and I think that's the best. That's the way all physicians should go about what they do. Is would you offer this to people or family members? Would you want them to come here?
Right. Yeah, that's the ultimate benchmark.
Benchmark. Really.
Yeah, accreditations are great.
Yeah,
but that really is kind of what sticks out.
Exactly.
Speaking of accreditations, I think one of the most recent distinctions that the bariatric program has gotten is becoming a Blue Distinction Center. I know a little bit about it. I'm going to defer to you because you're the expert here. What does that mean? What does becoming a Blue Distinction Center mean for this program?
Yeah, so one of the biggest payers, Blue Cross Blue Shield, has their own quality and cost benchmarks where they will allow their the people who have that insurance to go to those facilities. And one of them is Blue Distinction. And so Blue Distinction pretty much validates that, yes, we are an accredited center, but they have an additional quality benchmarks in addition to being just accredited. And then they're looking at whole person care, so and cost savings. So the fact that we can provide great quality care, and that this insurance, Blue Cross Blue Shield says, yes, you're providing it at a cost savings, or somehow it's beneficial from a cost perspective. And that's the ultimate thing, right? Great care at reasonable cost. And so that's, I think, the fact that they've recognized us for that is a big deal. And then it allows us to offer the surgery to more patients, so it increases access to patients who may have this insurance. So and that accreditation just happened, or this Blue Distinction just happened last month. So we're really proud of that.
Yeah. And that's got to mean, these accreditations, you can look at them on paper and say, those are great. I'm glad this program is getting these things. But I think for me, it really is impactful for the community to be able to say, we have a program right here in our area that we can go to receive this kind of care. And we know that it is going to be, care that you can rely on, that you can trust, that you know is going to be really high quality, exceptional care. I think more than anything, that's what these distinctions mean, at least from my perspective. And you may have similar thoughts, but when I look at that and I look at what that means for the community, it really just means, hey, there is great care happening right here in your hometown,
right,
and you can get it. You don't have to go to Sacramento, UC Davis, wherever. You can get it right here in Marysville.
That's exactly right, and it really is just that validation that you have everything it takes to be that quality providing program.
Yeah, absolutely. I wanted to take a few moments here to talk about the medical weight loss program that you guys are working on with bariatrics now. And from my understanding, it is it doesn't necessarily mean surgery. It's more of getting into, like you said, changing the lifestyle habits and getting some medical support through that. Can you tell me a little bit about this program and kind of what this can mean for the community?
Yeah. So the goal is always to be able to provide comprehensive obesity care.
Yeah.
And so really what that means is there are a lot of new medications out there that work really well for weight loss. And these shouldn't be looked at as competitors to surgery. They should be adjuncts, and they should be working in tandem to provide the best possible outcome for patients. And that means that, some patients, surgery is not the best option, or for some patients, medication is not the best option. And some patients, it requires both. And so how do we provide that extra level of care, not specifically surgery oriented? And that's where medical weight loss comes in. And so everyone's heard of these new medications, injectable weight medications, GLPs, where some of them are coming out as pills now as well. But they do work really well.
Yeah.
But I think they can't work well in a vacuum. You need to be able to provide the care with the dietitians. You need to be long-term support and follow-up, because if you don't do that, patients will regain the weight with the medications, even with the surgery. So it's all about providing the whole thing.
Yeah.
Medical, surgical if needed, the support. And so that's what medical weight loss is a nice adjunct for the obesity management in the community, which I think will overall improve the overall health of the community. And that's our goal.
Yeah. It's so fascinating. I was actually listening to a podcast this morning where someone was talking about, GLPs and all of that. And the thing that they mentioned is, it can help you make those necessary steps, right? But you still have to do the work. And I think a big thing about this program is it's helping provide the resources to allow you to do the work, to allow you to practice those healthier lifestyle habits, to, really establish, healthier lifestyle, establish a healthier lifestyle. I think that's really, really important. Like you said, it can't just be in a vacuum. And the other thing I was thinking about is, it really is a case of meeting patients where they are, and seeing what is the best fit for them. Could it be going the medical weight loss program route? Could it be thinking about bariatric surgery? It's really, like you said, trying to provide a comprehensive suite of services and care to help people in each of their unique circumstances.
You want to really individualize the care. It can't just be the same thing for everybody. And that's what, having those options is really important. And you're exactly right. Not having the dietitians and the exercise recommendations and the follow-up is really doing a disservice to patients. And so all those components have to be working together in order to get the best outcome.
Yeah, absolutely. I want to take a quick moment to talk about the Da Vinci. I think that's something we can't not talk about, right? It's such a huge thing that's happened for our hospital and for the community. It's the Da Vinci 5 robotic surgical system. You were a huge part of bringing that here in terms of being an advocate to make this a reality, to encourage the foundation, to the Adventist Health Rideout Foundation, to make this show of support for the hospital and get this community, get this robot here to this community. In your words, how big of a deal is the Da Vinci 5 robot?
I think it's a game changer. It's really going to allow us to bring big city technology to our community. It's the most advanced robotic system out there. And really it's a recruitment tool. It's going to help patients, have less pain, smaller incisions, quicker recovery, less, shorter hospital stays. So, and it's state of the art. I think really becoming a robotic center is going to be that next step of improvement and quality for our bariatric program, but for not only bariatric, but for surgery in general. For this community.
Yeah, definitely. I was thinking that as you were about to say it. It was like it's the next step. We've put so much work in. We've made such great strides. This feels like the natural next step to say this is how we continue to elevate the care that we provide for this community. Right,
and it's all close to home, right? So the idea is that you don't have to travel for this. We have it here, and we have the surgeons who can use the robot. We have everything here to have it done well, have great quality, safety, results. And so just bringing that closer to our community is really what's been really nice.
Yeah, absolutely. Dr. Garcia, before I let you go, I did want to kind of take a moment to reflect on kind of this journey that you've been on, that this bariatric program has been on. A ton of work, a ton of hard work to get to where we are today. What's been the most rewarding part about this experience? What's the thing that you look back on as we've gotten to this point with bariatrics? What's been the most rewarding part about it for you? I
think kind of mentioned earlier, but watching the program grow, watching patients as they go through the program and still follow up with us. I think that's been some of the most rewarding things, aspects of this whole journey. And it has taken a lot of work to get here. And I think I have to thank, everyone in administration in the hospital, the foundation, obviously, for their support, the community, our clinic staff, our program staff. It takes a lot of people to move this forward, and we continue to push it. I'll continue to push it because we want this, again, to be a nationally recognized quality program, and we're getting there.
Yeah, that's great to hear. And just the last thing I had for you, I think about bariatrics in a very similar way to the way I think about what's happening with cardiology at our hospital. It's one of those departments that is kind of leading the way. And I mean that when you're looking at Rideout and you're looking at the history that this hospital has had, over decades in this community, there hasn't always been a ton of trust. But over the last several years, we're seeing that change. We're seeing the community rally around us in a way that I don't think has happened in a long time. And I think departments like cardiology, like bariatrics, are really putting a lot of the legwork in to make that possible. People see the kinds of changes that are happening, the improvements, the level of care that's being brought to this area, and it's inspiring. And I guess I just wanted to ask you about the energy around not only this program but the hospital as we move forward in 2026. It really feels like, I've been here almost 3 years. You've been here, like you said, almost a decade. It really feels like this hospital is going in the right direction in terms of providing high quality, reliable, accessible care for this community.
That's exactly right. I think we are headed in the right direction. I think it's the people, it's the organization's goals. I think I've seen it. I think it has turned around, or I think there is a different perception of the hospital in this community. I think it's great. I think I want to work somewhere where I'm proud to work, that I feel like I provide everything I can, that my colleagues provide the best care, and that I'd be happy to have my family come to. I think that's where we're at now. Or I think before maybe we weren't quite there.
Yeah.
But there's definitely been, I think, a shift. And I think Adventist Health coming in and providing high quality organization and goals, and I think that's really what's started to set us apart.
Yeah, definitely. Well, Dr. Garcia, I want to thank you. This has been a fantastic discussion. I really appreciate the time. Is there anything else that you want to add about bariatrics, about the program going forward? Anything else that you might think the community might want to know in terms of bariatrics?
No, I think we mentioned a lot of stuff already. I think it's just again, I'm really proud of providing comprehensive bariatric care, obesity management. And I think the stigma around obesity is still all too present. And so really things like this, where I can get the word out about what obesity is and the medical aspects of it and what we provide, I think it's really important. So I'm happy to be here.
Yeah, definitely. Awesome. Well, thank you so much. This has been great.
Thank you very much.
Thanks so much for watching this episode of the Made for More podcast. Don't forget to like, comment, share, and subscribe. You can find us on YouTube, on Spotify, anywhere you download your podcasts. Don't forget to follow us on Facebook at Adventist Health and Rideout to find all the news and updates from around the hospital. And thanks so much again for watching.